Namibia has recorded its first COVID-19 death from Walvis Bay. The deceased is a 45-year-old Namibian national. Joining me on the line is the Minister of Health and Social Services, Dr. Kalumbi Shangula. Good evening, Doctor. Thanks for joining us.
Good evening.
Dr. Shangula, there are so many questions surrounding this case in terms of when the Health Ministry came to know about this patient and when he was tested. May you shed more light on this?
Yes, thank you very much. According to our records, the deceased presented himself to the Walvis Bay Hospital on the 5th of July, 2020, with complaints of dizziness, difficulties in breathing, and coughing. What is also known is that this is a person with comorbidity of psychotic nature, which make the person more vulnerable. On examination, he was then given a diagnosis of pneumonia with a differential diagnosis of COVID-19 and then transferred to the transition ward. That happened on the 5th of July. The next day, on the 6th, specimen was taken from him to test for COVID-19. And then on the same day, the condition started to deteriorate. He continued to complain about difficulties in breathing, chest pain, and he became a bit disoriented. He received the appropriate treatment. On the 7th of July, his condition remains the same, but then the medical team noticed that he had edema of the face, in other words, swelling of the face. And then on the 8th of July, the condition became worse, and then the patient died. I just want to explain that the deceased was tested for COVID-19 on the 6th of July when he was still alive. The results came out on the 10th of July, that is today, when the person has already passed away. So that is the circumstances surrounding this case. And before I move any further, I would like once more to extend our deepest sympathy to the family of the deceased.
Doctor, can you let us in on the burial arrangements, and may the deceased's identity be revealed?
According to the proclamation and according to the law of the state of emergency, as was declared, anybody who died of COVID-19 will be buried by the state and not by the family because of the contagiousness of the disease which claimed the life of that particular individual.
And doctor, in terms of the revealing the identity of the deceased, is that allowed? Can you fill us in on that?
That you may have noted that in all our updates, we have never referred to cases by name. We have referred to individuals by number. That is also to protect the identity of the individuals concerned. The identity of the person involved will leave that to the family.
Doctor, while we're at it, can you also update the nation on how the testing is going in Walvis Bay as well as other towns, and whether the ministry is intending to aggressively roll the testing out to the rest of the country?
We are actually embarking, or we have embarked on expanded targeted testing throughout the country. We are not only testing in Walvis Bay, we are testing throughout the country. And all the data or the report I have been given all the days include cases from all over the country. However, we have seen over the last few days an upsurge in the number of cases, especially in the Walvis Bay area. And that is also attributed to the fact that Walvis Bay has embarked on active case search, which now revealed that a number of inhabitants of that region have been affected, and that's why the number of cases in Walvis Bay, they are higher. But it does not mean that we are not testing in all other parts of the country.
So, Doctor, we are aware that there's been a backlog of testing at NIP. How is the current situation, and are we challenged in terms of resources to meet the intended targets?
Yes, due to the fact that we have increased the expanded targeted testing, the number of specimens, they now outstrip the capacity of the laboratories to do the tests. We are receiving on a daily basis around 600 specimens, and we are testing almost 400 tests per day. So we do have a backlog. But the Namibia Institute of Pathology has instituted measures in order to overcome this backlog, which include to introduce an 8-hourly shift specifically to address the backlog. They have also recruited additional 8 medical technologists who have started working this week. And we have been using NIP and PathCare to do the testing. We are also now exploring other options, other private laboratories to be brought in, and where necessary to capacitate them to be able to do the testing. This week, our team is in the Karas region in Oranjemund to assist the laboratory at Namdeb. Since they have the necessary machinery, also to be able to do the tests. And we are also in consultation with our neighbor Botswana, so that some of the tests which are taken along the common borders can also be done there, because they have test facilities along the border. So there are many options which are being considered in order to try to address the backlog, and also for us to be able to increase the number of specimens received per day.
That's very good news, Doctor. And on that note, seeing that other regions are now reporting COVID-19 cases as well, how can private institutions as well as able individuals come in to aid government to contain further infections?
The private sector is already on board. As I have indicated earlier, that in terms of testing, currently Pathcare, which is a private laboratory, is doing the tests, and also NAMDEX will soon come on board. So the private sector is already involved, and we are collaborating with them.
Mm-hmm. We'd like to thank you so much for taking the time to shed some more light, Doctor.
Thank you very much indeed.
And that was Dr. Kalumbi Shangula shedding light on COVID-19 matters and the country's first recorded COVID-19 death.